All right. Senator, we'll give everyone a chance to join us here. We are going live for
Yeah.
our daily COVID update briefing. Thank you, everyone, for joining us. We have a very, very special guest tonight, so we will just give everyone a minute. Sometimes it takes a little time for people to catch on to the live feed to make sure that everyone is there. I'm going
Mhm.
to bring it up. Thank you for joining us. Good evening, everybody. Thank you for coming. Good evening. Good evening.
Good evening.
Good evening, everybody. We'll just give everyone a moment to join us for our very, very special live update with a very, very special guest. So we will get started, everyone, in 1 minute, 60 seconds. 60 seconds, we will get started. Thank you. Thank you all for joining us. I hope everyone is healthy and safe as always. So thank you so much. And thank you to our wonderful special guest, Senator Washington, for joining us. Thank you. Thank you. All right. So we got 30 seconds, everybody. 30 seconds before we get started. 30 seconds. Do, 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 do. All right. All right. Thank you, everybody. Welcome to another Brandon's briefing on COVID-19. I'm Council President Scott. Today we have another very, very special guest that's joined us, Senator Washington, who represents us very well, representing the 43rd District in Baltimore City. We're going to be discussing COVID-19's impact on the 43rd District and what the senator has been doing, some of the great work she's been doing to support her constituents, raise awareness about COVID-19, but also about the city, the census, and our community responses to COVID-19. I'm going to give the senator a great bit of time to talk about those great works and update us on what's going on with her. But first, as usual, I want to start off with the latest statistics about COVID-19. As of today, we are now up to 10,784 cases of COVID in Maryland statewide, a total of 392 deaths statewide. In Baltimore City, we're up to 1,160, with 31 of those 392 deaths here in the city of Baltimore. So, again, as always, everyone, please adhere to social distancing guidelines. Make sure that you're following those guidelines to keep yourself healthy and safe, for your family and friends and those who you love healthy and safe. Yesterday, Mayor Young and Governor Hogan issued executive orders making the use of face masks or face coverings mandatory locally. That's effective immediately. The governor's statewide thing goes into impact on Saturday at 7 a.m. We know this is something that I called for early in the week because this is the advice of public health professionals following the guideline of the CDC to make sure that we're keeping people healthy and safe. You should wear a facial covering when you visit essential businesses, grocery stores, convenience stores, pharmacies, retail, and other commercial businesses that are still open. And also when you interact with delivery personnel from essential commercial businesses, or if you're living in an apartment complex, do not allow those maintenance workers and people to come in without a mask as well. Also, employers are going to be developing policies on face covering as well. And we're going to keep you guys updated on that consistently, making sure that you have the best guidance. I know the senator's done a great job of sharing that information on her social media as well. And according to the CDC, last thing before we go to our wonderful senator, face covering should fit snugly but comfortably against the face, be secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damage. And you can get more guidance at cdc.gov. But now, everyone, I want to welcome to officially to our Facebook Live here, Senator Mary Washington. Senator Washington, for those of you, it shouldn't be many people who don't know who you are, but for so those of you, the few people who may not know you and your great work, talk about yourself, how long you've been doing this great work in Baltimore City as a public servant long before you were elected, and then also talk to us about the 43rd Legislative District and what you're hearing from your residents as we navigate through this global pandemic.
Thank you, Council President. Thank you for this daily briefing, this opportunity. One thing that this COVID-19, this pandemic, I believe, has demonstrated to all of us is our interconnectedness.
Yes,
Um,
ma'am.
Too often, when there are problems in communities, particularly underserved communities, uh, many folks are able to think, well, that's someplace, that's a problem that's in South Baltimore, that's a problem that's East Baltimore, that's a West Baltimore, or that's an Eastern Shore problem, or a Western Maryland problem, or a Baltimore City problem. And
Right.
this epidemic is highlighting for us the fact that we can't see it, right? And but it's in the air, it's in our bodies, and it's showing the ways that we are connected to each other. I'm State Senator Mary Washington. It's a pleasure to be here this evening and have an opportunity to share my experience, strength, and hope. My biggest thing that I've seen is that so many communities and people here in this city have really stepped up to help each other. I've been a state senator for a little more than a year. Prior to that, I was a state delegate for 8 years. And as the council president referenced, I've been a community association president, served on various boards, and like so many people that I'm sure those of all of you are watching, just try to do what you can every day to make your community a little better.
Yeah,
Um,
and Senator, talk about a little bit about that. Like, what are you hearing from the many different? And the 43rd legislative district is kind of like a microcosm of Baltimore. What are you hearing from the different neighborhoods, the community leaders there? What are the folks saying about COVID-19, and how is your district taking it? And what are you hearing? How do you hear that compare from the people around the city that are talking to you about it?
Yeah, as I said, similarly, that everyone is concerned and fearful, and at times hopeful, at times feeling sad, at times feeling happy that there's a way in which we can all be together. Specifically in the 43rd district, we go from North Avenue up to the county line, over the Hartford Road, over to Charles Street, swing down around Wyman Park Dell, Hopkins campus, lots of, we've got Terra cafes in the district. So we are a microcosm of the
Shout
city.
out to Terrence.
Yeah, so we had to give a shout out. And so we encompass everything. We have $1 million mansions, and we have bombed out storefronts. We have 3-story apartment buildings. We have 10-story apartment buildings. We have single family homes, multifamily homes. So we have everything. But what universally people are concerned, many people are concerned about their economy, their how are they making a living. So many folks are being laid off.
Mhm.
One of our largest workers are hospitals, our service industries. People are concerned about how we're getting a lot of calls about how do I sign up for unemployment benefits? Or my Medicaid application, is it being processed? I'm trying to close on a house. Am I going to be able to get a notary? There are Delegate Learman spoke, I guess it was yesterday or the day before, about food insecurity, and people are concerned about how are they going to eat. So a lot of the concerns that are here in this district, and our small businesses, and making sure that they're able to weather this storm. So there are so many things that are happening in our district, and but we are doing our best to support people and to help them get through this.
Thank you. And Senator, one of the things that I've always admired about you is about a lot of times you have folks. I think that you and I share in this, that when folks are either in service, political service, they're either policy wonks or people who can work with communities to get things done. You are following the line, much like myself. You're both. Talk about, and one of the things I think that's so great about Baltimore is when things are tough, like we come together like no other place, right? People across Baltimore are helping their neighbors get food, getting their prescriptions, getting their groceries for them, making sure that children have access to different things that they need. Talk about how your office, who has been integral in this in your district, the world or the efforts that you've been involved in. Can you talk more about that concept and the
Absolutely.
concept of mutual aid, which has been excellent?
Yeah, we established. I saw the need right away in my office. We turned ourselves into helping to coordinate activities. We formed the 43rd District's COVID response team. Other communities have done that as well, but my group, my team, uh, we formed that. So it's been about a month, I would say. Actually, yeah, today is the first day we kicked it off. And we are offering resources to all four corners of our district. We established an 800 number, and the 800 number for the entire 43rd district is 1-800-291-5457, and it's a hotline. And the hotline we established.
Senator, repeat,
Yeah,
like, just because I know my comms people are, if I had a little earbud, they would tell me to say it again. They always tell me to say the number twice. Say that number again for the 43rd District residents.
43rd District COVID Response Resource Team is 1-800-291-5457. And that hotline is being staffed by association presidents within the 43rd District and volunteers. And so when somebody's going to pick up the phone, or the person that's going to call you back, it could be somebody from my office. I want to give a shout out to Janae, who has really been leading this effort, from our office, but my whole team has been leading this. But the volunteers are neighbors. The team is comprised of neighborhood associations like Woodburn, McCabe, York Road Partnership, Waverly, Greater Northwood Covenants, Hamilton Hill, Cold Spring Homestead, Montebello. Hello, Mark Washington out there.
Hey, I talked to Mark earlier today. Well, Mark
Able,
talked to me.
Remington. Yeah, they're just working together, to do that. And so also as a part of that, we forged partnerships with the ICC, which is the Italian Cultural Center. And there has been a program called Be a Chef for a Day, and they have established a warm food initiative, which is serving most of our seniors, and it's become this real reliable source of fresh, hot food. Something that we don't talk about is the importance of having a warm meal. Those of us that have worked with people who have housing insecurity or people who are food insecure, there's often the idea, well, you provide people with a cold lunch, a cold sandwich, but there's a psychological and physiological impact for having a warm meal. And so since we know that once we get over, or as we pass through the initial, as we flatten the curve around COVID, there's still going to be the social impacts, there's still going to be the economic impacts. And so people are going to become increasingly food insecure. We also have to address the mental health perspective of isolating. There's some of us who like being alone, don't mind, could be there all week, could be for days and days. Others, it is a major problem. And so
And for the record, everyone, I'm in the other category. Not being able to be out and talk to people and be amongst people is driving me nuts. Sorry, Senator. I'm just,
this is supposed to be a conversation.
Yeah,
This is my
for
first
the
time
record.
doing this.
Yeah. Yeah, I think that you bring up a very critical point, because I just think that it's different, right? Like, for me, it's tough because I can't stare at a computer screen all day. But just talk about that a little more, about what kind of work that's going to require for us to do to deal with, and especially in a city like Baltimore that already has a lot of health disparities, mental health disparities, and home and food insecure people. And now this is adding more to that burden.
Well, folks should Google the Pro Bono Counseling Project. Again, they're one of our partners, and they provide free mental health services to those in need. Just to finish up what's happening in the 43rd District, the Cloverland Dairy has given and provided milk through families. The Franciscan Center that's in the 43rd District, Pleasant Hope Baptist Church has been really engaged as a part of this partnership. There's even a True Balance social. Yes, outdoor wellness initiative has been offering yoga, and they've been streaming, and they've been hiking and at a distance. And we've delivered 75 grocery bags to families, 20 families on SNAP, over 200 seniors, assisted families obtaining internet, school packets. There's just been all kinds of things. But I know I wanted to talk about the census if I could. I didn't want to run
Yeah,
out of
no,
time.
I was actually getting ready to go right to that with you too, and say that thinking about this and thinking about what you were saying about the economic impacts of this, and it makes the census even more important. And you've been doing great work of leading around the census, and I've been talking, but I think it's time for someone. I want to mention to everybody too. If you have questions for the Senator and I, make sure that you put those in. We will definitely answer them. So please put them in the chat. We'll make sure that we get to your questions. Just submit them, but talk about how important the census and why even more so now that we're going through this global pandemic, that the census is going to be critical for Baltimore.
It absolutely. So if you don't know that, I mean, there are some core things that we have to do. Voting, you need to take care of your health, right? Be a part of your community, work, there's certain things, pay your taxes. And then every 10 years, we as a country take a picture of who we are. And it lets us know who we are so that we can do two things. We can figure out how we're going to allocate the resources that are needing the hundreds of billions of dollars in public and private spending every year is impacted by the census. And also the apportionment counts. Our representation in Annapolis, as well as in Washington, D.C., is dictated by the census count. And I'm sure you've seen it in the newspaper and different places that, it's a challenge counting everyone, particularly in urban areas like Baltimore City. And if we're undercounted, that is an average of $1,800 per year. So over the course of 10 years, up to $18,000, $20,000 per person that's undercounted. And I just wanted to list some of the things that when you make sure that you turn in your census, it's affecting education, Title I, housing, low to moderate income housing loans, food and nutrition, health, communities, transportation, almost every single thing. Now, the good news is, even though Census Day officially is April 1st, you can still be counted. And there are for the first time, you can do it online. And you can also call. I have a couple of people from the Census Bureau have joined this call, and so if there's some specific questions that you need to have, right now, as of April 14th, Baltimore City has a 40% response rate, so that's good. We're getting on track. Our
All right,
response rate
Senator,
was only
tell them
yeah.
about some of the cities that we're beating, right? We're in
Yeah.
constant competition with some cities.
Right now we
I'll
are.
start with the one I hate the most. We're beating New York, so we'll just start
Oh,
there. But yeah,
so we are currently, well, see, I don't want to, so, I don't want us to rest on our laurels, but we are beating Boston, New York, Philly, Los
right.
Angeles, Cleveland, but our goal is to get to at least 73%.
That's right. We got a
So
long way to go.
we should get to 100%. But last time we only did 67%. So think about that. If you think about like $1 and somebody gave you 67 cents for every dollar you had in your pocket, you're coming up short. So right now we've got to make sure that Baltimore City, for all the money that we potentially can get, that we can get that. So I just want to give the number that you can call. It's 844 330 2020. If you want to call in, and we can provide that. It's on my Facebook and all that. Also, if somebody's Spanish speaking, 844-468-2020. And you again, or you can go online. And now, you probably, if you didn't turn your form in, you probably got another reminder in the mail this week. Don't wait for the pink envelope. Wait for there's not going to be a shut-off notice, but you have to every week. every week they're going to remind you and say, let's do it. So the Baltimore City Complete Count Committee is actually having a really fantastic incentive. It's called the Be More Census Challenge. And if you take a picture of yourself with your census invitation, so this was my census invitation, right? And you take a picture of yourself for social media, or you create a meme and you post it. And if you tag Balt Plan on Instagram or Baltimore Planning. If you get the most number of likes, you can get a $75 gift certificate for grocery delivery services. So, we, as Baltimore City, there's a Baltimore City Complete Count Committee. Mr. Austin has done a great job at leading that initiative. And what my colleague Stephanie Smith is also part of the leadership of that initiative. And I'm also part of the Maryland Complete Count Committee with my colleague. Oh, excuse me, somebody's microwaving. We're all doing. Janelle Wilkins from Montgomery County, and so we're going to continue to work not only in our own jurisdictions but across the state to make sure that hard to count neighborhoods, people that have a lot of children, that often you'll count the older children, but for some reason the young kids don't get counted. You have to make sure you count everybody that's in your house. What did it say? Everybody.
Yeah,
So
everybody. If
that's
he
who.
was if he was still here, and since I now taken up the mantle of saying it, if Congressman Cummings was still here, he'd say lottie dottie and everybody. So
Yeah,
everybody needs to be counted. Absolutely.
yeah, and I need to dispel any concern people might have about their information. The census is the most secure thing that you can participate in. It is a federal crime. It is illegal. You cannot share census information. It's not like Google. It's not like Facebook that is going to share every move you make and they'll sell your information. The US government cannot do that. Also, the census taker themselves, it cannot do that. There is a fine and mandatory sentencing for violation and providing information. So this is something where you can provide the information, you can say who's living in your household, all the people who are living in your household, and that information cannot be given to your landlord, that information cannot be given to anybody else. It only goes to the census, and it will be a part of making sure that all of Baltimore City gets the resources it needs.
Thank you, Senator. I think that you have a hard stop at 8 o'clock, right?
I just moved it back a little. Just did a little text and I can
All right,
I can
good.
do a little
So
after.
we're gonna take some questions, and then I have a few other. So we had a great question that came in. Someone asked, this is a question for both of us. Is how is your family doing? How are you checking on the elders and the loved ones in your life? I guess I'll just start. So for me, this is one that is very, very important and critical. I'm blessed. I started communicating with my parents and older folks in my family via video phone call about 3 years ago. So now they're accustomed to that. So that's how I communicate with them. As many of you know, most of my family still lives in 21215 in the Park Heights area, which is the hotbed in the city and really in the state, the highest number. So it's a very challenging thing for me. My mom works at the giant supermarket in Reisterstown Road Plaza. I actually will be there tomorrow, checking on the workers there. But we're just trying to make sure, telling my parents, my grandparents, listen, my grandparents in particular, like, don't leave the house. If you need groceries, I'll go get them. Just call me and let me know, making sure that they're healthy, making sure that they need what they need. But I'm blessed to have my family be healthy right now, but just making sure that I'm looking out for them, but also looking out for my neighbors. Almost all of my neighbors are seniors as well, trying to make sure they're healthy and safe, and just giving out the best information to people as possible.
Thank you so much. It's a difficult time. I want to give a shout out to all of our healthcare workers, and
Amen.
also the people who are working in long-term care in our nursing home and assisted living facilities. And you are right at the front lines and the hotbeds, and we need to be doing so much more to support you, support mandatory testing, support making sure that you get the PPEs that you need, that you're getting the support, the rest that you need. Those people are taking care of our communities. My mother lives in one of those communities. I haven't been able to see her since March 8th. Fortunately, her facility shut down early. Fortunate that there have not been any COVID cases on her floor, but it is in her facility. And so I know so many of us are praying every day and doing our best to support our families. So thanks for asking. I see my mom on Zoom. twice a week at least. And my other brothers, I have 5 brothers and sisters, so everybody's calling in to check in. We share time. The facilities are doing a really good job of keeping families connected, and we need to do more. There's been a lot of focus on the hospitals. There's been focus, and our seniors, our most vulnerable people, need all of the technology and all of the support. Their lives matter as well, and I can't say that more strongly.
Yeah, thank you. I think that's critical. And just all those workers, man, fire, our trash workers, police, all those people that are just putting themselves at risk, our bus drivers. We know we have two more of those individuals who've been doing great work of trying to get those other essential workers to work. Thank you all from the bottom of my heart. Someone asked a question, what kind of advice are you giving residents in your district, especially the seniors, Senator, about how to keep them, their families, and themselves safe?
So please, please, if you don't ask for help. Do ask for help. Your neighbors, you can make the call. You can call us. I'm just going to look for the number again, and call and get help. You can call 211. You can call 311. We just received a briefing today about how those calls are being tracked. You should stay inside. But if you're able to, you know, look out the window, call a friend, make sure that a lot of folks are very independent, and you have your patterns, and there's a thing that you like to do every day. But this is a time for us to just to all slow down, and really understand that even though this isn't something we can see, it's a threat, and that we should just assume that everyone is contaminated to some degree or the other. And if we operate from that perspective, we're protecting ourselves as well as our communities. But what I'm specifically talking to seniors about is to make sure that somebody has your phone number, that we're calling and checking in on people. We've identified where seniors are living and making phone calls. The state has a check-in number that you can call. I'll post that later, and to just have somebody call and make sure that you're okay.
Thank you. Thank you. And I guess, Senator, we have a question came in, and I'll take this one about the confusion about the seventh district race and what's
Yes.
going on. And thank you, Ray. Shout out to Ray Kelly since he asked the question, my brother Ray. Ray, this is something that's concerning to me too. And this is why we're going to be talking again furthermore with the Board of Elections about making sure that we're putting information out. We're putting information out on our social media feeds, reminding people that they don't have to pay to mail that ballot back. They put it in the mail and it goes back, making sure that they're only putting, if multiple people live in the house, that they're putting it in not all in one, making sure that they're separate so that all of those votes are counted, making sure that we're pressuring and pushing the Board of Elections to communicate more, because we know we have this election, we have another one coming up on June the 2nd, and you can rest assured that we're going to do everything that we can do from our standpoint to make sure that they are communicating in a better way, but they're also the most important basic right of anyone in our city and our country is the right to vote. They were protecting that in every way. And I'll follow up with you directly about some other ways that we're going to be doing that as well. Senator, before I let you go, we know last week the governor released the data by race, and we have zip code, something that you fought for, that I fought for, and we know how this virus is disproportionately impacting the Black community and low income communities. You and I both know a lot of that's rooted in decades and decades of systematic inequality. But talk about what that now that we're on with that data, right? What should folks be doing? How should they be taking that data to fight to make sure that they are not having people in their neighborhood and Black people who meet those pre-existing conditions? How should they, in your opinion, be dealing and fighting COVID through that lens of racial equity and understanding?
And thank you for this, because it's a good way to wrap up. What we cannot do is blame survivors and say this is about something about Black culture, or this is about the way people are. This is, in fact, about exposing the systematic, centuries old inequalities. This is because certain populations have already had disparate impacts on healthcare. We've already have disproportionate numbers of chronic diseases, and that is all absolutely embedded in economic and racial inequality. So what we should take from this is that we need to end poverty. We need to end segregation. We need to make sure that people have access to health care, and that as the resources come in, as the federal dollars come in, we need to make sure that just because people are able to write grants, or people have the connections to the establishment, or they have the connections to the nonprofits that seem to run everything, that we make sure that those dollars are put on the ground, that they are, Christine Flowers, that they're, that there are people who are on the ground every day doing the work, that those dollars need to trickle down. This is one time where we shouldn't just have trickle down theory. It has to actually come down like rain on these communities. And so that's what we need to do. So you vote, we advocate, you write letters, you make noise, you say, look, my community is not receiving the resources it needs to educate ourselves. We're not getting, our workers are not getting the safety that they need. They're not getting the ways that they can protect themselves. So that's how I see it, is that I'm glad that we have that racial data. It just reinforces what we've already known. And so that's what we take. We take it into the future. There's a lot of talk about going back to normal after all of this. And I
No,
think that's
that's
not
the
what we
last
should
thing
be
we need
doing.
to do.
Yes, we should be going to new. We should be going to the next thing. We should take the lessons and say, yeah, we are connected. My future is connected to your future. My health is your health. My school children are your school children. And we should take that vision forward. In the meantime, stay safe, stay inside. Those you have to go outside, wear your mask, wear your gloves, take them off, pray, eat, sleep. And it is a beautiful time of year in Baltimore. As much as you can, use the stillness and the quiet to really look at your neighbors and look at the trees if you can, or look at your children, and just be grateful that we're all here together and we're going to make it together.
Yeah, thank you. I think that is absolutely what we have to do, Senator. It's not about going back to normal. It's about building a better. We can have a better future for all of us together post COVID-19. I want to thank you for taking time out of your busy schedule to join us on what I'm sure is one of many Zoom meetings today. I want to say that there's some folks that had a few other
My
things.
favorite one.
Yeah, thank you. Likewise, likewise. That some other questions that folks had about enforcement around like Pennsylvania Avenue and places like that. We're also now starting culturally sensitive messaging around COVID-19. We have to meet people where they are. We can't just criminalize all the activity. And there's an individual that asked about working in the trades and being in close quarters. I just ask that you send us a direct message so that we can follow up directly with you. And the last thing I want to say to everyone is, again, everyone must hear this. Everything that you do right now should be guided by the advice of public health professionals. Stay safe, practice social distancing, wear your facial mask and covering. We'll be doing tutorial videos. I might get a little flare in my mask with the city flag or blue and gold to represent Mervo. Make sure that we are keeping ourselves safe and healthy. Thank you to our wonderful senator for joining us, but more importantly, for being a wonderful public servant and serving the city, especially during this tough time. So thank you, Senator Washington. Thank you, everyone, for joining us tonight. And we will see you tomorrow. And Senator, we will see you soon.
Yes, you will. Take care.
Thank you.